Okay, Doc Blind? Ready? And 5, 4, 3, 2, 1.
Good afternoon, everyone. So welcome to today's talk on smoking and vaping. And we are very lucky to have a powerhouse of speakers. And thank you, of course, to Central Visayas chapter for helping the Council of Control of Tobacco and Air Pollution in creating this great opportunity for us to be able to discuss the ill effects of smoking, not only for the adults, but especially to the adolescents. So thank you for the collaboration with the Philippine Pediatric Society. Today's World No Tobacco Day. It was first started around 1987 to highlight the fact that smoking can cause preventable diseases, and it is important for us to be able to help our fellow men to quit smoking, and of course for our children not to start smoking. So without much ado, thank you very much for this opportunity. Thank you for our speakers, and I hope we have fun and we're going to learn a lot this afternoon. Thank you very much.
Thank you. Thank you, Dr. Glaina Ong Cabrera. She's currently the head of the Council on Control of Tobacco and Air Pollution of the Philippine College of Chest Physicians. Thank you, Doc Glaina.
Thank you.
Sige. So for tonight, as Doc Glaina said, so we will be having a lay forum, and we welcome everybody to tonight's activity. This is a very special moment because we're celebrating World No Tobacco Day, which is an advocacy to encourage everybody to really recognize the importance of quitting smoking, okay, and the ill effects of smoking and vaping, particularly among adults and adolescents. And that's what we're going to discuss tonight. So tonight, I'll be your host. I'm Pen Villamor. I'm a pulmonologist based here in Cebu. And together with me as my co-host is Dr. Steven Seno. Dr. Steven Seno is an adult, is a pediatrician.
He's a pediatrician.
Specialized in developmental pediatrics. And he also hosts a TV program, My Health in My TV, here in Cebu. So welcome, Dr. Ban. Thank you for...
Good evening, and good evening to everybody who's watching right now. We welcome everybody to this lay forum on the effects of adults of smoking in adolescents, smoking and vaping in adolescents and adults. So, Dr. Pen, if you will give me the honor of introducing our distinguished panel for this evening. So, right above me, so I have with me Dr. Cristeta A. Gormez. She is a pediatric pulmonologist practicing primarily at the Mindero Medical Center. And in our center square, we have with us Dr. Tomas Folioso Jr. He's an adult pulmonologist practicing at Chonghua Hospital and the president of the American College of Chest Physicians Philippine chapter. And to my furthermost is Dr. Mercy Lipio Uy. Dr. Uy is an adult pulmonologist and is the training officer at the section of pulmonary medicine at the Perpetual Suffer Hospital. So to Dr. Gorme, Dr. Folioso, and Dr. Uy, good evening to all of you in behalf of Pen and myself.
Good evening, everyone.
Good evening. Thank you for joining us tonight. So this is a collaboration, as Dr. Glaina said, this activity is a collaboration of the Philippine College of Chest Physicians, Chest Philippine chapter, and the Philippine Pediatric Society Central Visayas chapter. So we're all based in Cebu, but we're reaching out to all of you here in the Philippines, those who are viewing right now. Okay. So our topic, as we said, is about the ill effects of smoking. So I guess everyone is aware that smoking is bad, diba? I think that's already a given. Okay, diba?
No.
I think nobody would disagree to that. Okay.
Right.
So we'll go straight to the point, Dr. Ban. We know that smoking has a lot of ill effects, and one of those is one of those conditions that are really grave caused by smoking is cancer. So how is smoking related to cancer? So we'll ask one of our speakers. Maybe you could ask Dr. Mercy Uy. How is that, Doc, related? How is smoking causing cancer? And what cancer? What kind of cancer?
Okay. Smoking is actually the most common preventable risk factor for cancer, any type of cancer at that. So studies have shown that smoking is linked to 21 diseases, 12 of which is cancer. So it's obvious na since it's inhaled, so the most common of which is the lung, no, the lung cancer. And then down to your myeloid, acute myeloid leukemia, a smoker, anyone who smokes at least 100 sticks in their lifetime, that is someone who is considered a smoker, is at risk of even acquiring acute myeloid leukemia from that, no? 1.5 to 2% ang iyahang risk, the risk of that person getting from cancer from smoking. So what is in the cigarette or what is in smoking that causes cancer? So number one is the tobacco-specific nitrosamine. So these are actually from the nitrates that are used to preserve the tobacco that is used in our cigarette. And then once this is combusted, then it produces, aside from that, 250 more harmful substances in the cigarette smoke. These have all carcinogenic effects in our body. So eventually they cause formation of cancers.
Okay. So, Doctor, in layman's terms, if you are a smoker, how much more likely are you to develop cancer?
So number one, if you are a smoker, you have at least 30 to as much as 70% risk of developing cancer. But oftentimes the patients throw that back at us na, how come I have a grandfather who is already 80 years old and they have smoked in their entire lifetime for as long as they can remember, and yet they do not develop cancer? So our textbooks would tell us that the lifetime risk of a smoker developing lung cancer is only 10%, but that is lung cancer. But when you look at it from the perspective of cancer per se, they saw that 12 types of cancers are actually related to smoking. And of the cancer-related deaths, about 48% of those who died from cancer are actually smokers. So it is a very big percentage that the moment you smoke, then most probably you are putting yourself at risk. So we also have patients who said that I am only a light smoker, doc. I only smoke when I drink. I only smoke when I eat, after I eat, no? So they said, what is the threshold for someone to smoke ba? Na they will probably, a threshold that will put them on the other side na they will have the adverse effects of smoking. So actually, when you say 1 to 4 sticks, you are already placing yourself at risk for any type of cancer associated with smoking.
Okay. Doc Mercy, thank you for giving us the stats. No, nakakatakot. It's quite scary. Okay. In fact, we can say that smoking can really kill, diba? Because, you know, you've mentioned about death and everything. And you've also mentioned about the components in the cigarette, no? You mentioned certain chemicals, no? So you said there are a lot of chemicals in the cigarette, okay? So we've read that we've heard that there are about 7,000 chemicals, and many of these are carcinogenic. Okay, established carcinogenic particles, okay, or substances. Okay, so it's really quite scary. Okay, and smoking can also cause other diseases, no, other than the cancer that what Doc Mercy mentioned. It's also known to cause one of the common diseases we have, which is COPD, okay, chronic obstructive pulmonary disease. So we have an expert here to discuss with us what is COPD. Dr. Tom Polioso, can you please enlighten us? And how can smoking cause COPD, Doc?
So if you're an adult and you've been complaining of shortness of breath, difficulty of breathing, or chronic cough, most probably you already have COPD. So when you say COPD, it basically means chronic, meaning hindi na siya naaalis, chronic no? Obstructive, ibig sabihin may nakabara. Pulmonary, ibig sabihin sa baga. And disease, ibig sabihin ito ay sakit sa baga na parang may nakabara sa pagdaan ng hangin, kaya nahirapan kang huminga. And almost always, the most preventable cause for this is cigarette smoking. Although generally hindi naman cigarette smoking lang, no? So lahat ng mga smoking from the environment, so yung iba, we are fortunate na kasama tayo sa tinatawag natin na bold study years ago, na burden of lung disease. Then makikita natin na hindi nga sila naninigarilyo, pero yung ginagamit naman nila sa pagluto sa bahay, puro usok naman. So, mga usok galing sa firewood. So, nakaka-cause din yan ng COPD. Pero ang pinaka-pervasive talaga is cigarette smoking. Such that na kung if we have to advise people to refrain from smoking, malaking ginhawa na yan. Kasi lalo na if they learn to smoke at a very young age. So if they learn to smoke in their teens, automatically, since alam naman natin, lung maturity comes full at age 25, so hindi siya magiging, yung lungs niya will fail to develop very well if he smokes early, and he increases his chance of developing COPD. So majority sa practice natin, alam naman natin na worldwide, this is the 4th leading cause of death. So nakakapatay talaga siya. So hindi lang nahirapang huminga yung mga pasyente, but nakakapatay itong sakit na ito.
At
And
irreversible, Doc, no? Once you have it forever.
Kasi that chronic, permanente na. So the only thing, in other words, hindi siya curable. Yun kasi ang mga problema sa pasyente. Once they improve, they thought na ititigil nila yung gamot. Simple lalala. Kasi nga, walang cure yung COPD. The only thing we can do is really help them breathe better and delay the progression of their disease. And the most important way to delay it is, of course, to quit smoking altogether. So that is really the message we want to spread across.
Yes, Doc. And you mentioned about the symptoms earlier of COPD. How will they know if they have it? You mentioned chronic cough and difficulty of breathing.
So this comes as early as age 40, no? So of course, hindi naman ibig sabihin na younger patients hindi magkaka-COPD. But majority, kasi nga, matagal na siguro silang naninigarilyo, and then maliban doon, even if they have quit, if they are with people who continue to smoke, the second-hand smoke continues to harm them as well. In the same manner that the second-hand smoke, as mentioned earlier, is the reason why even if we quit, why cancer, as mentioned by Mercy earlier, is a big problem even for the non-smokers, because we are dealing with the environmental tobacco smoke, which is basically what second-hand smoke is. So additive and then yung pollutants pa. So talagang there's no escaping.
Yeah, so it's good that you mentioned second-hand smoke. We'll discuss that actually later, Doc.
Right.
What you're saying, Doc, no, is that it's not only harmful for the one who is smoking, but also the one who is exposed to smoking can also have effects, no? The grave effects that you mentioned, which is cancers all over the body, or COPD, okay? Which is something really hard. When you have it, di ka na makahinga.
Right. So ako, Ben, I'd like to ask our pediatric pulmonologist, Dr. Gourmet, as to what is the experience. So we've talked about the adult experience, the cancer and COPD. So how does it affect children and adolescents, Dr. Gourmet? But how does smoking present in children who do smoke?
Yung sa pediatric age group po naman, Doc, yung effect ng smoking will start pre-conception or from conception forward or prenatal. Meaning, prenatal, hindi pa po pinapanganak yung bata. So it happens when the mother during pregnancy is smoking. At it can also happen kahit yung mother is not smoking, pero yung asawa niya or anyone from the household or from the workplace na doon nagtatrabaho yung mama is mayroong someone who is smoking and she is exposed to the smoke from somebody else, which is tinatawag natin yung second-hand smoking na mini-mention po ni Doc Pulyoso. So yung effect po yun sa bata is parang sa smoke kasi nandun yung carbon monoxide at alam po natin na yung carbon monoxide is parang very attractive siya to oxygen, di ba? So sa kanya didikit yung oxygen. So ang nangyayari is there will be no enough oxygen that will be delivered to the growing baby. So ang nangyayari, magpo-cause po siya ng mga tissue damage to the developing organ, especially sa lungs, sa brain, at saka sa puso. So pwede yun, mayroon siyang multiple congenital defects, yung bata.
And also, they're small, no, Dr. Gourmet? When they delivered, maliliit yung mga babies that are delivered from smoking mothers.
Yes po. Then, mayroon pong studies that there is a strong correlation po ng maternal smoking to miscarriage of the baby. So parang spontaneously aborted po yung bata during pregnancy. And if successful naman po yung pregnancy or parang hindi po siya na miscarriage, there's a tendency na ma-deliver po yung bata na hindi aabot ng 9 months. So parang premature po yung preterm delivery. At if in case po na hindi po preterm delivery, umaabot po ng 9 months, pero yung bata po paglabas is very low birth weight po sila. Yes. So parang 1 out of 5 pregnancy po na yung mother is smoking will lead to low birth weight po.
Okay. So, Pen, parang yun ang sinabi mo, Doc Pen, no, na smoking causes death. So apparently, it's not just in the adult, no? So even the child who is a passive recipient of the harmful effects of smoking can also die. No? So it does kill on so many fronts, in so many ways. So it really does push, no, for no smoking, really to stop smoking altogether.
Yes, because it is a killer.
It's a killer.
Aside from what you've discussed, no, about causing cancer, COPD, and the effects in the mother and in the unborn baby, okay, are there other Are there other diseases that are related to smoking? Doc Mercy, can you mention other diseases that can be attributed or can be aggravated because of the smoking?
One journal actually cited na aside from that, it is related to the development of diabetes, acquired diabetes in some adults. Tapos, yung COPD, tapos pneumonia, no? Yung mga smokers are actually at risk of getting more severe pneumonia from yung influenza virus or yung streptococcus pneumoniae, no? Yun yung parating sinasabi ng patients na, Doc, magpapa-inject ako ng pneumonia vaccine. That is actually the bacteria that we are protecting them against. So they said their theory is that yung nagsusmoke, yung oral cavity niya becomes more susceptible to colonization. Para bang yung Streptococcus pneumoniae, yung bacteria na nagkakos ng pneumonia, likes to live within the oral cavity, no? Or yung sa may likod ng baba. Tapos dun siya, it frequently enters the lungs and eventually causes overwhelming pneumonia. So kaya it puts them at risk. Then there's also one journal na sinasabi nila na if you smoke, you have a higher tendency of getting tuberculosis, no? Acquiring the disease, no? It makes you at risk for getting that disease. So not only does it cause cancer, but also other diseases.
Infectious diseases, because it lowers your immune mechanisms, no? I also learned that it can actually, the smoking daw, yung cilia, it paralyzes the cilia in our airway. The cilia is the one that pushes mga particles, whatever phlegm outside, but it paralyzes, so hindi kulang, no? Hindi kaya to push out all these foreign material, foreign bodies and phlegm that gets accumulated because they are paralyzed when you smoke. Okay? Sige, how about COVID? Pwede din, meron yatang studies lumalabas if you are also at higher risk, no? I would surmise because nga lower ang defenses, no? COVID is a respiratory disease. Yeah. Can you add that, Doc Polyoso?
50% increased severity. Yun yung problem natin with smokers, no? Mas malala karamihan yung COVID nila. And then they have mas increased din by 50% yung chance to get COVID than those who never smoke. But ang importante yata, Mercy, yung common talaga natin nakikita, yung mga stroke and the heart attack,
Yes.
yung mga cardiovascular. So pwede mo, probably you can elucidate more doon kasi yun yung pinaka-preventable no?
Oo, yes.
Dami talagang sa bagay, nagpaparami sa hanap buhay natin. Kaya lang, we don't like it that way. Ha?
Right.
Correct, Doc.
But I would not say na it's really, I really just have to mention that kasi yun talaga nagpaparami ng pera ko, yung mga naninigarilyo na nag-a-atake kasi sila yung na-admit And then, ang sabi ko sa kanila, masyado sila matulungin. Tinutulungan lahat yung doktor. Tinutulungan yung mga heart centers natin. Kaya punong-puno palagi. So, but of course, we would not like them to do that. We're not happy with that. So,
yes, Doc. So you've mentioned a lot, of ill effects of smoking. So we started with cancer, then COPD, the effects on the pregnant and its fetus and its baby, and of course yung infectious diseases, pneumonia, TB, and COVID, and now heart disease and stroke, which is our top morbidity, cause of morbidity all over the Philippines. Nasa top 10 yan.
And then bringing it back to the adolescent side naman, Ken, So we understand that smoking is a gateway drug, for you to start on other vices and habits. So, Dr. Gormley, how young, so these adult smokers, they start in their adolescence, they start in their teens. So, how frequent is smoking? So we're talking about Cebu setting, we're talking about the Philippine region. So how common is smoking in the adolescent age?
There's a survey that I read, Doc, in 2017 that actually 20.8% of high school students do smoke.
Right.
Then as early as grade 7 or grade 8, 7% of them already started smoking.
So 1 in 5. That's fairly large, no? And then
Yes.
Is there a greater incidence between young men and young women, or boys and girls, or of equal prevalence lang siya?
Preferential, most of Doc is for male, but there is also an increasing number now with the female smokers, usually mga social smokers because they want to be cool or they want to
Right.
because there's peer pressure, Doc.
Right.
So yun
So
yung
that's something that
usually
our adult pulmonologists here will not be able to experience so much. So yung concept of peer pressure, kasi mas prevalent, that is a more prevalent issue in the adolescent because of the developing adolescent brain, and also the hormonal surge that comes with it. So I understand that peer pressure is a big factor for adolescents to start smoking. And
Yes,
it's
Doc.
through social media and through certain influencers who are advocating it. Okay, so maybe that's something that we can also advocate, not just for individuals, but also those who have a platform. So to use that platform in order to advocate for no smoking, especially at this time.
Yes.
All right. So ikaw, Ken, going back to
So do we see an increasing trend of adolescents using cigarettes? Or
Yes, actually, Doc, there was an increase of 11% to 20%, Doc.
and there's another, yes, Dr. So it's increasing. And then there's another that they're using right now, di ba, ang e-cigarettes or vape. Di ba?
Yes,
Yun yung parang mas popular
Cool.
among these groups. Okay.
Yes, Doc.
So we will segue to the e-cigarette and vape. So,
vaping.
okay, how are they different, or how are they the same with cigarette? The cigarette. Maybe we can ask Dr. Mercy first.
Okay, so yung mga e-cigarettes are actually electronic, no, electronic devices that simulate, no, they give the feeling of smoking, but yung contention nila is it is not burning, okay? It's the act of burning the tobacco that gives daw the cancerous, the carcinogens. However, so they just heat the liquid and then produce a vapor when it's inhaled, no? So that is, it simulates smoking. So originally, it was concepted back in the 1930s. However, it was not clear if this was patented or not. Then it came back again, the idea came back again up around 1960s when a certain Gilbert, no, Mr. Gilbert, made, since his friend died of lung cancer, no, someone near to his heart died of lung cancer. So because of smoking, so he wanted a safer alternative for smoking na hindi makakos ng lung cancer but still gives you the benefit, parang benefit of smoking. So it was not, it was initially patented at that time, but because the tobacco industry was also increasing, no, at that time, so it died down. Then it came back in 2004. The Chinese actually had the first patent. Si Honlik, siya ang nakapatent ng first e-cigarette, and then it was during that time na booming na ang business until now. So
Yeah.
yun lang.
So ang e-cigarettes, maybe Dr. Polyoso can add to how is e-cigarette different from the cigarette that we know, or how is it the same with it?
Yung popular talaga na e-cigarettes doesn't contain tobacco. So, gaya ng sinabi ni Mercy, it's an electronic. In other words, it's a battery-operated na gadget. So, the first thing that came out in China in 2003, yung first generation, are what we call cigalike. Kasi talagang mukha siyang sigarilyo. Kaya lang, disposable din siya. Kaya lang, ano siya, yung walang tobacco sa loob, it only contains liquid na heated nitong atomizer, no? And then because of the propylene glycol or the glycerol that comes in the solution, ito yung responsible for making yung plume or yung smoke. Gives you a feeling that you're smoking. Pero kung yun lang sana, we don't have that much problem. The problem is itong mga bagong generation. Especially ito yung fourth generation. Ito talaga yung nag-i-increase ng smoking, and the most number of smokers are actually in the teens. Gaya ng sinabi ni Dr. Yorme, ang problema natin actually with these devices is it actually encourages people to smoke. Nagiging normal na ulit yung smoking. We had been very successful for years with all these fight against tobacco companies, and ito, pag nanigarilyo, hindi siya, you're not in, parang ganon. But with the introduction of these flavors, ito yung flavor kasi ang nag-attract ng mga teenagers. Dito tayo nagkakaproblema. Kasi if we really just are after those who are already smoking and really cannot quit, and then this is an alternative, then of course it's a lesser evil, no? Because alam naman natin, because it doesn't contain any tobacco, so the only risk there are the substances that are present. Ang constant naman kasi na present in all of these e-cigarette liquids are your nicotine, your propylene glycol, the glycerol, and itong mga flavorings. So ito talagang flavoring. So how we wish, kasi hanggang ngayon hindi natin nakukontrol yan eh. So yung flavorings, if we can do what we did with tobacco, na binabawal natin yung mga flavorings, I think hindi siya masyadong mag-click.
Pero ito po yung nakaka-encourage kasi sa iba, di ba, to use it.
Yes.
And you mentioned nicotine, Doc. Nicotine is a substance that makes it addictive, no? It's the one that sticks to our brain. Ito po yung receptor sa brain natin that our body will try to look for it again and again because it's the addictive factor. So, pero meron nagsasabi na, going to ano naman, you talked about e-cigarette it has those components, but does it also have the carcinogens?
Yung yon, ang mga data dyan is hindi pa siya masyadong marami kasi depende kasi sa solution na ginagamit. No? For example, we know that glycerol is and propylene glycol are converted to aldehydes, no? So becomes formaldehyde and acetaldehyde, which are both carcinogens. But since bago pa nga kasi itong mga ano na ito, mga electronic cigarettes, so we know that these are carcinogens, but we don't have big data yet on the
Yeah.
risk of cancer. But of course, since kukunti lang naman yung carcinogen nila, so if you are a chronic smoker and you shift to these electronic cigarettes, then we would say na it's a better version, no? Kasi mas kukunti yung harm nila kaysa tobacco, actual tobacco. But then here comes the heated tobacco products. Pumasok na rin eh kasi if you haven't noticed yet, ang mga most makers of these e-cigarettes are actually the big tobacco companies now. Sila na
Yes.
yung may-ari ng mga ito kaya they introduce tobacco back. So mayroong yung sinabi ni Mercy, heated tobacco.
Ito yung
Na-
Juul, Doc, no? Juul?
Ayo, yung
Tawag
Juul,
doon?
ito yung mga flavored. Kaya yung mga
Mm.
bata, pag sinabi mong vaping, hindi nila nakukuha yon. Pag sinabi mong juuling, ayun, juuling ang tawag nila dyan because yung pinaka-popular sa kanila is yung Juul. Juul kasi yung make it attractive, may mga candy flavored.
Okay.
So ito yung mga pangit, ito yung mga sweet flavored, ito yung mga highly carcinogenic. No, halimbawa yung cherry flavored, benzaldehyde. Benzaldehyde yon. That's a very potent carcinogen.
Okay.
So,
So-
kaya even though not theoretically for those who are finding it difficult to quit and would prefer electronic cigarette because nasanay sila sa habit na may hahawakan then din ipasok sa bibig, no? So sabi nga ni Sigmund Freud, they're fixated on the oral stage.
Or faith.
Oo, so kaya ipe-prefer talaga nila yung electronic cigarettes. So para doon sa grupo na yon, it's a better version, no? But yun ang problema. Hindi kasi yun ang users ng mga electronic cigarettes. Ang mga users are those who have never smoked. And most commonly, these are the high school students. Itong mga middle school or high school students. And makikita mo ito kahit sa atin, meron ng mga ganito. And then ang sad reality pa, if you have noticed in the news, gusto pang ibaba ng Congress yung bibili ng mga vaping na ito. Kaya we really enjoin the public to watch this, nasa news yan eh. They're going to lower the age of people who can buy these electronic cigarettes from 21 to 18. And
So that's really alarming, Doc, no?
That's very, very
Right.
alarming.
Dr. Gormy
Very, very
mentioned
alarming.
kanina the rise of the use of smoking products, cigarette products, tobacco products among the adolescents. Do you, the introduction of these products, the e-cigarette, the tobacco heated products, have contributed to this, Dr. Gormy?
Yes po. Yes po, Doc. So, and I also agree with Dr. Pulyoso na yung mga teens po talaga ngayon is into the vaping or the e-cigarette use because it has something to do with the flavor. Doon sila naiinganyo. Yun po yung nakaka-attract sa kanila kasi mayroong mga different fruit flavors, then mga yung mga different fragrances. So,
Right.
tapos may misconception kasi sila, Doc, na yung flavored na e-cigarette is parang less harmful siya or less nicotine. At saka yung iba naman din, parang sinasabi na wala siyang nicotine na label, pero in reality, meron po siyang konti na nicotine. Or sometimes, may sinasabi na ito lang po yung content ng nicotine, but there is a wide discrepancy of the actual amount of
Yeah.
nicotine in the
Hindi kasi
e-cigarette.
sila regulated, no? Hindi
Yes
sila
po.
regulated.
No.
That's why there's no way of checking the actual level of nicotine. Where in fact, there could be there. And then yung na-mention po nyo, the preservatives po can actually be carcinogenic in themselves, di ba?
And then, ang
Right.
problema
Oh.
pa natin dyan, Pen, they can order it online.
Oh,
They
Yeah.
can
It's
order
very
it
accessible.
online.
Very
Yes.
accessible
So
to them.
talagang accessible siya.
And
So, and then, ewan ko, may data ba tayo dyan, Dr. Yormi, na kasi sa US, yung mga gumagamit ng mga vaping, automatically, it lead them to go back to, experiment na rin. So, nag-increase lalo yung cigarette use kasi nag-graduate sila from this,
parang
from
dual
this
user na
vaping,
po
dual
sila.
user na sila.
Yes po.
That's right.
Sa atin
Okay.
ba, ganyan din?
Yes
Dito
po.
sa atin?
Yes, ganun din po yung nangyayari, sir. Actually, yung first na reported case po sa atin ng E-Valley is a teenager, yung 16 years old po from Cebu. So initially po, ano lang po siya, parang vaping lang po, per pressure lang po. Pero parang siguro experimentation niya din, parang nag-smoke, yung cigarette smoking din po siya.
So yung
E-Valley,
ending niya,
Dr.
Dr.
Dual.
Oo,
Dual
it
pala,
started with
dual
vaping,
user.
Mm-mm.
and
Yung
then she started to
combustible.
smoke.
Yes po.
So it
Okay.
dual.
And then,
Doctora, for the benefit of everybody, what is E-Valley po? What is
Ito-
E-Valley?
Yung e-cigarette or vape associated lung injury. Actually, meron po siyang criteria. Parang 4 po yung criteria na i-fulfill para masasabi po natin na confirm yung it is a confirmed case po na E-Valley. So dapat parang may criteria siya na dapat 90 days yung use niya, ma-fulfill niya yon. Tapos meron po yung sa chest x-ray or sa CT scan, meron pong chest findings na mga infiltrates or opacity. Tapos ma-roll out po na not due to infection yung nakakos ng opacity sa chest x-ray or sa CT scan. Then yung fourth po is yung chest findings niya is not related to other diseases such as yung sa heart ba, may contribution, ma-roll out po yun. So dapat ma-fulfill po yung 4 para masasabi natin na confirmed case po siya ng E-Valley. Pero if may, parang kung 3 out of 4 lang po yung ma-fulfill niya, especially yung hindi totally ma-roll out na due to infection, parang i-label lang po siya as probable case na E-Valley.
okay.
Okay, so this
So 16
patient,
years old.
yeah,
16.
very young. First
Yeah.
reported case, no, sa Philippines.
Yes po. Pero siguro underreported po siguro siya, Doc, no? Maybe mayroon ng earlier case na hindi lang po na re-report sa DOH na identify, yeah. Or, yeah.
So this case can be used in this example to be presented, for legislature. So now the first case is actually an adolescent, and it's led to further complications because were there other complications this patient experienced, Dr. Gordon? So apart from, what did she present with? What were her symptoms?
Actually,
for
the
our
patient
viewers?
initially presented lang po with dry cough like for
Okay.
2 weeks. Parang sabi lang niya, parang ordinary na cough lang, tapos hindi siya nagpa-konsulta. Pero parang eventually po, parang nag-experience na po siya ng shortness of breathing. So mayroon na pong
Okay.
difficulty of breathing, and that's the time na parang hingal na po siya, Doc, kaya nagpunta na po siya sa emergency room. Tapos yung patient naman po is previously healthy, tapos wala po non-asthmatic, wala po mga food and drug allergy. So if i-relate po yun talaga yung pag-use niya ng e-cigarette, yung cause ng mga symptoms
niya. Yeah, the symptoms are like COVID, no?
Mm.
COVID symptoms.
Okay.
Oh, but this patient survived naman, Doc, no?
Thankfully, Doc,
Survive
nakasurvive
naman.
na po siya.
But there were reports abroad na that the patients expired, okay, because of an acute lung injury, parang very inflamed lungs.
Okay. So how
you
ano
mentioned-
nang symptoms niya ngayon? How is she now? Is she better, or meron bang chronic na
Yung
symptoms that she felt?
first, during the first 3 to 4 weeks po siya, Doc, meron po siyang intermittent na bronchoconstriction, parang nagwiwis po siya. Pero after that po, parang mukhang okay naman siya kasi hindi na siya, kasi nagpa-follow up ako sa kanya pero hindi na naman siya bumalik. Close to follow up.
Pero, pero
So
hopefully
again-
buhay pa, ha?
Yes
Bye,
po.
bye.
Kasi I mean,
Good
constant
document.
communication po ng mama niya.
Yeah,
sa
kasi
PhD po
teenager
niya.
to eh. Problematic teenager. But it's good that you documented, doctor. So for our viewers here, or doctors or healthcare practitioners, we encourage you to report such cases so that we know the information. As Dr. Polioso said, kulang pa rin yung information that we know about the effects, the long-term effects of these products. Okay, so I just want to be clear on the vaping part. Now, so we discussed e-cigarette, the Juul. How about the vape? The vape. Is it also similar to e-cigarette? It's
Ang
to the
Tinatawag
Doc.
natin na vape mainly to differentiate it from smoking. Pag sinabi kasi natin na smoking, tobacco eh. So kaya tinatawag natin na vaping if they smoke e-cigarettes. So basically yon lang yon. And then yun nga, ang problema natin is actually the third and fourth generation. Kasi itong mga danger na sinabi ni Dr. Yorme, yung mga ibali na yan, it's mainly because yung mga cartridges pag nag-empty, nilalagyan nila ng kahit ano-ano dyan. Ang pinaka-common culprit talaga for all these is yung mga adulterated na cartridges. Hindi ko naman
Okay.
dinidepend yung mga gumagawa ng mga but
Right.
we really
Okay.
just have to state the reality na itong mga ibali consistently is because mga bootleg no? Yung mga cartridges, nilalagyan nila ng kahit ano-ano na mga flavoring. Kasi you can buy the flavorings separately in the vape shop. And then
Right.
ipo-pour mo lang yan doon sa sa Juul mo.
Cartridge.
Oo, sa mga cartridge. Yun yung problema. And then yung iba pa, dinidrip pa nila yung liquid doon sa atomizer. So, lalong nag-i-increase yung mga nicotine doon. Alam naman natin na yung safety level ng nicotine sa bata is only 10 milligrams.
Right.
And then yung
Yeah.
karamihan ng mga vaping liquid na ito can contain up to 20 milligram per ml. 5 ml yung isang cartridge. So that's easily 100 milligrams. Kaya toxic talaga siya.
Okay.
Okay, so
So, may second-hand smoke. Meron din bang second-hand smoke sa vaping? Is that
Vaping.
also something that we should be worried about or concerned or part of our counseling?
Meron, kaya lang yun kasi hindi pa siya masyadong studied kung ano yung effect. Unlike sa tobacco, no, we know everything about the secondhand smoke. And then, hindi rin natin alam kung gaya sa cigarette, may third-hand smoke din siya, no? Kasi alam naman natin, yung mga smokers, yung mga environmental tobacco smoke, pag nakapasok yung naninigarilyo sa kwarto, hindi na yan maalis. Dumidikit na yan. Yun yung third-hand smoke, which is actually not smoke, but the particles coming from cigarettes na nag-interact naman doon sa mga other substances in the room, and then nagiging na-inhale mo ulit, kaya nga na-smell mo eh. So ito yung mga problema natin sa tobacco. Sa vaping, we don't know if that is occurring, but yung second hand is, no? We just don't know how much harm it can produce because bago pa nga kasi itong mga vaping na ito. Gaya ng sinabi ni Mercy, 2003 ito nag-hit sa China, then worldwide by 2006. It's all over. It's a hit. It's a blockbuster. No?
but clearly, Doc, it's causing a lot of problems, especially among our the adolescents, the teenagers, because it's encouraging them to smoke, to use the product, and addiction. It doesn't address it. Encourages the addiction because of the nicotine content, and also yung fixation, the oral fixation, and the worst pa yung dual use, no? And very scary ang dual use na they use the e-cigarette along with the actual tobacco products. So that's really quite alarming, I would say. Okay, and if they start early, kasi later on they might all develop the diseases that we all mentioned kanina. Okay, so at this point, maybe we can entertain some questions from we have had several questions here in the chat box. So, Dr. Ban, would you like to read the first question?
So if I scroll up, I'll just start off with this question that pumasok sa chat ko. So what are the this is coming from our PPS Central Visayas chapter member. What are the short-term and long-term effects of passive smoking on children? So maybe Dr. Gourmet can help us answer that question with regards to short and long-term effects of passive smoking in children. So we now know that some families do smoke in the presence of their children. So what can we expect with regards to the harmful effects, both short and long-term?
So for the short term po, Doc, parang yung common na bronchitis sa bata, parang hyperreactive po yung airways nila. Tapos the development po ng pneumonia at saka yung otitis media, yung middle ear infections. Kasi sabi ni Doc Pen kanina, she mentioned about the effect of the cigarette smoking sa cilia. Yung parang hindi na siya masyadong effective para ma-propel yung mga mucus. So yun po yung ano po yung at saka it's a trigger po din ng asthma.
Right.
Trigger
Yeah,
ng
and
asthma.
worsen exacerbate asthma.
So hindi lang siya within the lungs. So you're also talking about the ears and other parts of the body, as you are exposed to secondhand smoke. Okay?
Yeah.
So
We
ano
have
pa bang
another
questions
question
natin,
here,
Pen?
Dr. Ban. I will read from Dr. Fanan, one of our pulmonologists also in Cebu. So yesterday was World Vape Day. So kung may World No Tobacco Day, meron ding World Vape Day ka. Dapat World No Vape Day naman, di ba? Kasi World No Tobacco, World No Vape Day. So what do you think of vape as a tool to stop smoking? Oh, this is a very good question because, people are thinking that vape is a better substitute to tobacco products. So can you comment on this? Maybe you can ask Doc Mercy. What do you think of vape as a tool to stop smoking?
So as of now, Doc, officially the PCCP, the body of PCCP does not recommend vaping as an alternative for smoking, and especially for use as a smoking cessation tool. So officially we are not recommending that. Now, if we go back to the discussions prior, it's a lesser evil as of now. But still the key word there, the operative term, it's still evil. It's a lesser evil, but it's still evil. So it is not advocated as a smoking cessation tool. If you want to quit, quit. Diba? Don't shift, just quit.
Okay, very well said, Mercy. There's a follow-up.
So hindi siya step down. It's not a step down. So if you want to stop smoking, stop
Just
smoking.
quit.
Just quit.
Just quit. All right. Very
Okay, there's a
straightforward.
follow-up.
Yeah,
Another
but
question.
may
Okay,
dagdag
sorry.
na ako dyan, that is really in ideal situation, but in the real world, ang dami talagang pasyente na no matter how they try, so you prescribe them Varenicline, they can afford it, but they hindi talaga maalis yung nila addiction to cigarettes. And then since they are already, of course, hindi mo siya i-guide to e-cigarettes. That's a no-no. But some of them are already into e-cigarettes. So for cases like this that really find it difficult, then the only thing we can do is, yes, it's a better alternative, we tell them, but they should really aim better to totally quit. Kasi alam naman natin, it's a lesser evil, but gaya ng sinabi ni Mercy, it's evil just the same. We don't really know the long-term effects, kung ano pa yan, but we know so far na may mga harm siya kasi nga yung mga flavorings, yung mga ibang solution dyan are carcinogenic. So, if they can quit, they quit, but it's a lesser evil, and you really have to admit the reality na big business, so it's really difficult.
Yeah.
Really difficult. In the same manner that we have difficulty going against the tobacco companies.
So before the forum, I was talking to Doc Etat about Dr. Gourmet about support for adolescents who are trying to quit vaping. So in the US, for example, they have a support system through text, na kasi yung need for craving for vaping apparently happens at night, when they're bored or when they're anxious. So that dun pumapasok yung need for vaping, and then when they use a certain text, and then may sumasagot and giving them tools in order to stop from vaping. Is something similar in place in the Philippine setting? Is that something that is accessible to the Filipino youth at this time?
As of this time po, Doc, parang I haven't heard po of a group or a support group or something like a clinic na
Right.
catering to those who want to quit vaping or smoking for sa mga adults po or sa mga adolescents. But I know
It
for
will be a-
adults, meron na
Meron na,
For
meron na.
cigarettes, meron sa
Later.
cigarettes.
Yeah, we actually have a quit hotline.
Mhm.
Maybe I can share it now, the quit hotline of our DOH here. So we have a quit line. Everybody can contact this. No, if you think you need help in quitting, then you can contact 1558 quit hotline. And
Okay.
other institutions everywhere in the nation also have smoking cessation clinics. Like here in Cebu, we do have smoking cessation clinics. I know of one in Soto, but because of the pandemic, na stop yung pag-ano ng patients kasi sa outpatient, but we do have mga smoking cessation clinics, centers.
Pwede na po yung mga adolescents doon.
Yes.
Yeah, but we can form for the adolescents. Maybe this will be a good
Yes.
project in the PPS Central Visayas chapter to form something like that. Oo. Okay, so going back, we have several questions pa here. We have to address. There's a question here, Doc, now. Why do Cebuanos use Lumboy cigars? So for those who are not Cebuanos, Lumboy is tobacco leaf, 'di ba? Tama po ba? Tobacco leaf, rolled tobacco leaf Lumboy. Oo. So is there nicotine with this as well?
Actually, yung sinasabing lumboy, hindi naman talaga lumboy, no? Lumboy is the one that they use to wrap the tobacco. So may tobacco pa rin. There's a tobacco leaf and then niro-roll nila ng lumboy yan. That's why they call it lumboy. But when you actually ask them how they do that, they put a portion of the tobacco leaf inside the lumboy. So lumboy is actually a leaf that is, I saw a lot of that in my youth. Kasi yung sa mga uncles ko before, they used to smoke that, no? But they call that lumboy, but actually they buy a tobacco leaf and they roll it on
In the lumboy leaf.
So definitely it's tobacco.
Does it change the smell? Parang di ba siyang vaping na may flavor na siya na lumboy?
Wala, it's really
Kasi
just a
lumboy
plain
leaf,
tobacco smell.
it smells the same.
Okay.
Lang talaga siya.
But we can suppose, Doc, no, na if they say they use lumboy, they also, the tobacco is
It's
there.
still nicotine.
Yeah,
Kasi
it
walang
also
nag-smoke.
nicotine.
Pag sinabi mong lumboy, hindi naman nila i-smoke yung lumboy. Niro-roll nila yung tobacco doon sa loob. Kaya lang, inalis nila yung word na tobacco for you. Kasi sasabihin mong masama.
So Dr. Lechua added also no, na lumboy is Bisaya blueberry or wild berry and dried leaf is used to wrap the tobacco leaves. So as Dr. Paul also said, to enhance siguro the flavor. I don't know.
Enhance the taste.
Okay.
Very
Enhance the
Enhance
taste.
the taste
Yeah.
of tobacco.
And it's
Correct.
very popular here in Cebu. Doc,
Not
no?
only in Cebu, in the entire Visayas and Mindanao.
In the entire
Yung mga
Visayas.
uncles ko na sinabi are not from Cebu, they're from Butuan. So when they visit us, when my parents were alive, they smoke. So I send them out. They can only smoke out in the streets, not
Okay.
inside the house.
Doc, there's
And I
another
would like, I'll read another question, Pen,
Yes,
from
please.
our chat box. So from Maria Delpa's iPad, so what are the carcinogens? So where are the carcinogens found? Is it found in the tobacco itself or is it in the preservatives? And do cigarette filters help? So we can ask our panel, with regards to where the carcinogen is found, and do cigarette filters help with regards to filtering out the carcinogen?
Actually, Doc, the nicotine itself is found in the tobacco, and once the nicotine is combusted, it is burned, then it is converted to katong mga tobacco-specific nitrosamines, which are actually carcinogenic. Then plus the preservatives used in the cigarette. The filters, most probably they don't help. Why? Because they still get cancer from it. Because the smoke that is produced by the cigarettes still contain harmful carcinogens. Not that there are carcinogens that are not harmful, but they still contain carcinogens. So
Right.
Yeah.
So yung lumalabas, in other words, yung lumalabas out na ano, hindi yung na ano nila, na take nila because of the filtering supposedly. But there are very, very small, di ba? These particles are really very, very small that they can
Yeah.
actually escape the filters.
So, Ben, earlier, Dr. Pulioso was mentioning about a legislature, about stopping tobacco smoking. So, as part of the community, maybe we should also advocate for proper legislature. So, what is in the pipeline with regards to stopping vaping and stopping tobacco smoking? Okay, yeah. What should our audience know about that?
Steve, hindi stopping yung ini-enact ng Congress ngayon. Nilolower yung age for them to buy vaping products.
From
Ngayon
21,
kasi
parang
21
18.
yung age before they can buy one. Now the Congress is trying to lower it to age 18. Hindi pa sila kontento doon sa maraming nagbe-vape. Gusto pa nilang dagdagan. So that is really a very, very big concern for all of us.
The challenge, definitely.
Yes.
Because
Right.
What
so
we
hard.
can do, kasi nga sa pandemic, we have no access to them. How can we do our part? So yun talaga ang problema
Yeah.
sa atin ngayon.
Yeah, but in fairness, Doc, no, to our pulmonary community, our health groups, medical doctors are really very active in lobbying for fighting against these laws that are encouraging
That's right.
our constituents to have access to tobacco products. In fact, 'di ba, yung pag-ban nga na yung paglagay ng mga infographics, 'di ba, sa cigarette is one of the things we're pushed because we were really pushing for that, 'di ba? That they're already
Right.
placed there, what the warning signs, 'di ba?
Mhm.
Before, ang hirap anuhin yan, ipaglaban, pero finally it's there. And hopefully we can have that similar to control the vaping and the e-cigarettes,
Right.
which seems to be really, really quite a concern for especially our young population.
So
Actually,
with
basta
that,
matanggal lang natin yung mga flavorings, nababawasan
Ah,
na
yun na
yun.
yun.
Yeah,
no?
kasi yun
Ang
talaga yung
attractive
main-
talaga sa
Nakaka-
vaping are
Nice.
the flavoring.
Okay. So,
Iba-iba kasi ang daming fruity flavor eh.
Oo nga
Marami
po eh.
talaga.
Hindi
Tapos
nila
pati yung
alam
names,
with
Doc,
also-
no?
Ha?
Yung names are very inviting.
Ay,
Tutti
yeah.
Frutti,
And then,
bubblegum.
napaka-attractive ng mga gadgets. Kita mo yung mga
Colorful.
jewels na yan. USB lang ang laki niyan.
Marketing strategy yan, Doc.
Oh.
But we really have to emphasize, along with all those colorful, nice flavors, are the bad effects, no, that we all discussed kanina. So kailangan talaga we educate our patients, no, that it's not just the nice flavor that they get, but all the carcinogens and all
That's
the that can cause all the ill
Yes.
effects we discussed.
So
at this
Doc,
point, yeah.
our time is running up. No? So we'd
Yes,
like to give
ang bilis ng
time.
oras. Kami
Oo.
oras.
So we'd like now to give a few minutes to all of our panelists, no? Maybe a few minutes to give their parting words, no, with regard to this panel on World No Tobacco Day. Okay.
Okay, yeah.
So
Parting
maybe we'll
words and
start off.
Doc Teba, maybe they can also add something to how the patients can reach out, no? Where they can go if ever they want to quit smoking.
Okay.
Yes,
So we'll
you
start
can
to go with our the youngest and fairest of our panel. So Dr. Garme, can you start us off with regard to our closing remarks?
Okay, safe. And maybe before my closing remarks po, I would like to add lang po yung sa cut-off na 21. Kasi importante po yun kasi yung brain development po ng mga pediatric age group is until mga 21 to 25 years old. Kaya mas maganda na higher po yung cut-off sa yung legal age to use the different cigarette products.
That's right.
So sa parting words po siguro for the pediatric patients, maybe ano ko po yung sa parents nila na be a good example to them because yung mga bata are quick to spot the gaps between what their parents say and what they do. So be a good example to them. And if ever the parents do smoke, first siguro it's i-admit na yeah, I am smoking, and then tell them na siguro if I have the chance na mabago, I would not have started smoking. Tapos sabihin kung ano yung mga bad effects ng smoking para yung bata is ma-discourage po to start smoking. Then yung second po is quit talaga. Kasi sabi na ni Doc Mercy, do not shift but quit smoking. That's the best thing po na intervention for that.
Thank you, Doc. And
Thank
maybe
you.
the Pediatric Society can also form, to enforce the advocacy. Mga health
Right.
centers
Oo.
for our adolescents, our teenagers. Thank you. A
So
challenge.
itatap namin yung adult resources because until this evening, we were not aware of some of these resources which are available to us. No, so it was very helpful that we shared this night's forum together with the adult and pediatric medicine groups.
Yes. And then we can
So
hear. Yeah.
from Dr. Mercy. Now we'll see na Dr. Polioso, our center square, no, to our panel, but we'll go na to Dr. Mercy for her message.
Okay, so first, since most of us, no, actually in the panel, tapos yung mga, those who are watching us, no, for the physicians, no, not necessarily pulmonologists, all the physicians. So when do you advise your patient, or how often do you advise your patient to quit smoking or vaping? Always advise. Spend at least 3 minutes of your consult time with them, at least, no, to advise them to stop. Next, as a smoker, if your patient is a smoker, how do you advise, or when do you advise them to quit? Now is the best time to quit. It's always now. So if you have a patient who is not smoking and is trying to ask you, or even vaping, no, trying to ask you, can I explore the possibility? When is the right time to do that? The answer is never. Never explore the possibility of smoking or vaping. No? So in an ideal world, that would be what I would say. Then finally, the advocacy of the PCCP is always to quit and not to shift. So just quit.
Thank you. Very well said, Doc Mercy. Yan,
And
finally.
then, actually, Dr. Polioso.
Basically, yung dalawa has said everything. But ang sa akin lang, we really should take the cudgels, not to block these laws that are meant to encourage further vaping. Because once it becomes an acceptable thing to vape, then parang acceptable na, balik na sa normal na acceptable pala yung maninigarilyo. And that's the best way really to prevent that is we start with the youth, no? Kasi itong mga may edad na, ang hirap talaga, mahirap talagang baguhin yung nakaugalian na, no? So it's so easy for us to say stop, but we know the reality, it's difficult. So we really should start in moving na they should never learn how to smoke to start with. And that is the most important thing for all the parents out there, all the doctors who are parents or who are potential parents, or everyone. Let us make it an advocacy to make this Philippines a healthy nation again.
Thank you. Thank you very much. Okay, so we'll end the forum. Dr. Esteban, would you like to say something before I...
So I would just like to extend thanks to all of our speakers, Dr. Polioso, Dr. Uy, Dr. Gorman. Their advocacy, is contagious, and then we hope that tonight we've learned a lot of precious knowledge and pearls so that we can take with us into our practice and to continue to advocate for no tobacco, no vaping, for a healthier Philippines. Okay. Ben?
Thank you, Dr. Van. And before I end, I just like to share again another photo. Magpa-plug lang ako kasi World No Tobacco Day, maximize na natin ha. We have a tweet chat later for World No Tobacco Day. Commit to quit, not to shift. As the Dr. Mercy said kanina, as Doc Gorman and Doc Polioso, no? So this will be a tweet chat as we talk about smoking cessation and the benefits of quitting today. This is happening tonight at 9 p.m. So make every day World No Tobacco Day. This is another of the PCCP. Okay, move. Okay, kasi we've been having a lot of webinars kanina yung with Dr. Glyna sa DOH, no? So they're really working hard with about sa Congress, sa Senate,
Right,
ganyan,
right.
ganyan aspect din eh. Mahirap talaga yung maging doktor ngayon, lawmaker na rin. So
Okay. So Ben, before we leave, I'd also like to recognize yung
yes.
the participation of the Interim Committee for Adolescent Health, headed by Dr. Ana Pato, and then also the support by our PPS CV chapter president, Dr. June Bongos, also pediatric pulmonologist, for allowing us to join this evening's forum, which is very important. I think this may be our first shared activity with
Collaboration.
PPS, and so we hope to continue to do so in the years to come.
Yeah,
It has been
very
fruitful.
nice endeavor. Yes, we will continue to partner in this advocacy. Thank you, PPS. And of course, thank you also to the Philippine College of Chest Physicians, Council on Tobacco Control and Air Pollution, and of course, CHEST Philippine chapter for joining us in this collaboration for our advocacy. So once again, thank you everyone for joining us. Thank you, Dr. Teban, for being my co-host. And to our panelists, Dr. Etat Gourmet, Dr. Tom Polioso, and Dr. Mercy Uy, thank you for sharing your expertise with us tonight. We are all together in this advocacy to stop the root of all evil, okay? And quit, not shift. Okay, with that, we'd like to
Thanks,
end.
everyone.
Thank you very much and have a good night, everyone. We'll be posting a recording of this in our Facebook so that they can watch. Everyone can continue to watch. Thank you.